I am so wowed by today's conference. We have been participating for many years and just find this to be the place that the movers and shakers show up to have really important conversations. But today's conference feels like there is an exclamation point on the importance of those conversations and the right people here to do it.
I remember when we had this conference right after the passage of the Affordable Care Act, and the room was packed because we all wanted to know, how do we make the promise of the Affordable Care Act a reality? We know that it's going to be an uphill battle, and it's conferences like this that bring all minds together to say, what can we do at the state level to make sure that we keep that promise and commitment?
You know, there is going to be some big changes. The key is still, how can we make the patient experience higher value and higher quality on a continuous basis over time, using all the powers we have of advanced business practices, technology, etc.
The federal government kind of sets the pace, but at the point where the federal government is still in this place where they're trying to decide what the next pace will be, you have to really just look at your population and look at your state and understand what the needs are of your providers and your population and make that plan. That'll always align with what the federal government wants to do.
It's not money in politics, it's the patients that we care for, and that needs to be at the center of what we're talking about when we talk about what's at stake in the possible repeal and replace, that the replacement has to be meaningful, and that we're there to serve patients.
Social determinants of care is the moral, correct path to really understand your population. Let's put the money aside for just a minute and truly understand our patient population.
What are the opportunities that we have right here in Washington State to codify some of the amazing bipartisan approaches that we've taken to implementing the Affordable Care Act? We have the power, we have the opportunity. Let's codify it and keep it in Washington State.